Well, good evening, everyone. I'm Dennis Stone, Director of the Center for Advocacy and Social Justice at the Jacksonville Urban League. And tonight, our virtual town hall is about maternal health, and it's being led by Gabrielle Harris and Victoria Jack, who've worked on this. We did have a speaker that was supposed to be with us this evening, but it's going to be postponed due to a scheduling conflict. But Victoria and Gabrielle have prepared a presentation and we're looking forward to it. They are interns at the Center for Advocacy and Social Justice, along with Rachel Reed, who's also with us, and Sadia Barge, who is the coordinator of our veterans program. So with that, I'll turn it over to Victoria. You'll be okay.
Yeah, thank you, Dennis. So just a little introduction before we jump right into it. My name is Victoria Jack, like Dennis said before. I'm about to be a junior at the University of North Florida here in Jacksonville, and I'm currently majoring in information systems, and I'm so excited to be here to talk about the maternal health issue in both the United States and in Jacksonville. And Gabrielle, if you want to go ahead and introduce yourself as well.
Hi, everybody. My name is Gabrielle Harris. I'm a rising senior at the University of Miami studying public health and global health. And I'm also really excited to talk about maternal health today. Victoria and I have been spending a lot of time, just like throughout our academic careers, really going into this topic. So it's exciting to talk about it today.
Thank you. So before we jump into the slides. Am I going to be the one screen sharing or was it going to be Dennis?
I thought it was going to be Gabrielle, but I can do it.
Okay, thank you. Thank you.
Oh,
All right, so good evening, everyone. Thank you so much for joining us tonight. Tonight, we're going to be discussing the very pertinent public health issue, maternal health, and what those issues look like in the United States. So every year, far too many women in the United States experience preventable complications or even lose their lives due to faults in our maternal care system. These issues don't just impact individuals, but they impact families as a whole as well, and entire communities in this country, maybe even generations. So our goal this evening is to provide a walkthrough to the current state of maternal health in the United States, explore the disparities and challenges that continue to harm mothers and children, especially in marginalized communities, and discuss current efforts and future solutions that can lead us towards a safer, more equitable care for mothers in the United States. So, Gabrielle, whenever you're ready.
Yes. So I'm just going to start off and talking about the status of maternal health and what it looks like today. Just to begin talking about mortality, rates have dropped nationally from 32.9 per 100,000 deaths or 100,000 births to 22.3 per 100,000. However, it's the larger issue remains, and there's a large disparity in terms of rates within the maternal mortality rates. So while fatal pregnancy outcomes have decreased between these years, Black maternal mortality remains 3 times higher than other groups. And as an offset of this, Black infants are 2 times more likely to die during birth than other racial groups. And something I kind of want to speak on in terms of these rates dropping, it's not only a reflection of improved medical care, but it's also has to deal with how do we define maternal mortality, looking from pre-birth to postpartum. And since 53% of pregnancy-related deaths occur between 7 days and 1 year following birth, if you create a cutoff for that, you're gonna capture a lot less deaths that are related to pregnancy. And in terms of improved medical care, you can see that as of 2023, when these rates did drop, the Kaiser Family Foundation survey revealed that 21% of U.S. Black women still feel that they were mistreated by a healthcare provider due to their race.
So I want to talk a little bit more about racial and socioeconomic disparities when it comes to maternal health. So first off, about half of all non-Hispanic Black mothers experience gaps in healthcare coverage during pregnancy, often due to discontinuous insurance. This makes it difficult to access consistent prenatal and postpartum care, which is important during pregnancy. Over time, these gaps have contributed to a deep mistrust in the medical system, which can influence when and even if someone decides to seek out medical care. All due to those insurance gaps, women may delay or forego medical appointments or treatments, increasing the risk of complications during pregnancy. Next, looking at the socioeconomic disparities, we see that low-income women face greater obstacles. These include challenges with transportation, access to quality prenatal services, and postpartum support. Like I said before, in many cases, women in these situations are forced to delay or skip appointments altogether because of costs or work obligations or a lack of childcare. And when care is delayed, the risk of serious complications increases. These disparities are not just statistics, they represent very real barriers that continue to endanger maternal health in our communities. And I wanted to touch on in 2022, non-Hispanic Black or African American mothers experienced the highest maternal mortality rate at 49.5 deaths per 100,000 live births. In contrast, non-Hispanic Asian mothers had the lowest rate at 13.2 deaths per 100,000. That means that the maternal mortality rate for Black mothers was more than 3.5 times higher than the lowest rate for Asian mothers. I want to emphasize this to show that this is just one of the major examples that show that racial disparity in maternal health. And then this slide is just a visualization of those stats from the last slide. When we're looking at the non-Hispanic Asian mothers, that's 13.2 mothers per 100,000 live births. And then for Hispanic or Latino mothers, it's 16.9 individuals. Then for non-Hispanic white mothers, it's 19.0 individuals. And then we have that number again, 49.5 non-Hispanic Black or African American mothers. This shows that large gap in that racial aspect of maternal health. Now that we've seen the data and the disparities, let's take a step back and look at the major factors that contribute to that poor maternal health outcomes in the United States. So when we're talking about words such as like limited access to healthcare, we're referencing it could be due to cost, due to lack of transportation or lack of providers. And this will prevent timely and consistent care for those who need it. Socioeconomic factors, mostly referring to aspects like income, education, and housing that shape someone's ability to maintain their health during and after pregnancy. There's also healthcare system barriers from limited Medicaid coverage to a shortage of culturally competent providers, like implicit bias can be involved there. Pre-existing health conditions such as diabetes or high blood pressure increase risk, especially without regular care. On top of that, policy barriers like postpartum Medicaid cutoffs or Medicaid gaps make it hard to stay covered when support is needed the most. And then finally, we have the intersectional vulnerabilities where multiple risk factors like race, income, disability, immigration status, and combine and deepen that inequity. And then I'm going to go into a little bit more in depth on the next slide. So just for some definitions for these terms, limited access to healthcare can be defined as the timely use of personal health services to achieve the best health outcomes. When that access is delayed or denied because of cost, distance, or lack of providers, then those health risks increase, especially in pregnancy. For socioeconomic factors, these refer to things like income and education, like I said before, and occupation and access to resources. These factors can determine how easily someone can access care and maintain a healthy pregnancy. Pre-existing health conditions, like I said before, there's going to be high blood pressure, diabetes, or heart conditions. Without proper management, these can increase the risk of complications during pregnancy. For policy barriers, these are going to involve laws, policies, or regulations that limit or restrict someone's ability to access a service, program, or benefit. For example, Medicaid cutoffs during the postpartum period can leave new mothers uninsured at a critical time when they need it the most. And then back again to intersectional vulnerabilities. Like I said before, it's going to involve things like race, gender, disability, income, or immigration status. And combining these can create a unique experience of discrimination or disadvantage for those who are experiencing it. The more vulnerabilities that a person faces, the more barriers they may experience in receiving safe maternal care.
So now I'm just gonna go a little bit more deeply into the socioeconomic factors that Victoria talk about the social determinants of health and how they affect maternal health outcomes. So in this graph right here, you'll just see how social and systemic determinants go into maternal health care. And we'll just begin with education. So it has not only to do with degree attainment, which is related to your income level and whether you're able to access healthcare, and other needs for your maternal health journey, but also do with your competency within healthcare settings. Like, do you understand what the doctor is saying to you? Do you know your options within hospital settings so that if you need to advocate for yourself, or if you aren't able to advocate for yourself, who has that knowledge? Income, which is very broadly connected to all the other social determinants of health. So are you able to afford quality healthcare? Do you live in a house or able to afford a house in a community that's well resourced? And then of course, education, higher education, you're able to get a higher income. And so it's also related to food stability and food desert. So are you outside of health within like a healthcare setting? Are you able to engage in physical activity and eat healthy foods? And then housing is just really related to your built environment. So are you surrounded by a polluted area, um, your access to transportation and all of those things. And then community. Community is really one of the most important factors in terms of your health and determinant of health. So it has not only to do with where you live, but also your community support. So if you aren't able to access healthcare or you're not able to get the food that you need, do you have a community around you that you can support you in other ways? It's also related to safety and then also neighborhood demographics, once again, food stability and transportation. And then healthcare, of course, there's financial barriers to care, but then there's also when you do have healthcare, are there other things that are related to that that are preventing you from getting the quality care that you need? So eligibility gaps. Many mothers aren't eligible for Medicare and Medicaid, but they also aren't able to afford private insurance or they don't get it through their employer. So they fall between that gap where they're not able to afford care that can really take care of things like getting a doula or having a PCP on hand. That's also related to there's a shortage of PCPs currently. So if you don't have a primary care provider who can advocate for your needs, that can be a really big issue within maternal care settings. And then diversity of providers, it's proven that if you have a provider who's within your same racial group, you're more likely to have a better outcome in terms of like your pregnancy outcomes. And then also behavioral disparities, also something related to social determinants of health. So your eating habits, drinking habits, physical activity, once again, those are all related to whether you're going to have a positive maternal outcome. And then of course, structural determinants. So related to housing is redlining, the community that you're in. Are you well resourced? And then other historical inequities, Jim Crow, slavery, mass incarceration, those have had major impacts on communities of color and really lead to the social determinants of health here today that have led to disparities within maternal health care. And then on the next slide, I'll just talk what this looks like in Jacksonville. So in the first graph, this is showing your access to physical activity and also healthy food. So it says that 43.6% people in Duval County, which is where Jacksonville is located, they are within a half mile of a park. 34.2% are within a half mile of a fast food restaurant. 27.6 are within a half mile of a healthy food source, and then only 6.1% are within a half mile of an off-street trail system. And this is very similar to Florida statistics, but Duval County is predominantly Black, so there are disparities present in this too. And then the below graph just shows educational attainment. So majority of people in Jacksonville, they have at least a high school diploma, but most of them do not have higher degrees, which can really give you access to higher income and other social determinants of health, which we talked about earlier. And then the final graph on the right just shows the percent without health insurance, that's 11.7%, and the percent with health insurance is 88.3%. And so now I'm just going to speak a bit on a concept called the weathering effect, which is really related to all these socioeconomic factors. So the weathering effect is defined as chronic exposure to social and economic disadvantage that leads to accelerated decline in physical health outcomes and can partially explain racial disparities in a wide array of health conditions. And so the weathering effect has really been observed because there are disproportionate rates of early onset chronic disease among Black mothers. And these chronic diseases include hypertension, diabetes, respiratory disease, which are all very highly related to behavioral factors, which are also related to social determinants of health. So if you're not able to engage in physical activity, you don't have healthy food, you don't have a healthcare provider who can diagnose these things early enough, you're more likely to develop diabetes, and that can affect your birth outcomes because you're at a higher risk for a risky birth. And so the weathering effect was seen mostly among 30-plus-year-olds because they are more at risk for a risky birth, but now it's being observed between racial groups, just showing that Black mothers are facing a new risk that I wasn't necessarily seen before. And so now, if you guys could just scan this QR code, we're just gonna have a quick discussion about your experiences with reproductive and maternal care and kind of some issues that you could identify as um, needing to be addressed. So let me just present the slide. So one that we have right now is there's less care and prevention services for individuals that are not currently pregnant. I think that's definitely true. I think kind of what I was talking about earlier about competency within healthcare settings. If you don't know what to look for, what to ask for before you're pregnant, or before you're in that space giving birth, and now you're in the setting and you don't know how to ask those questions, how to ask for what you need. So I think it's important to engage in education about that. Does anyone have anything they want to just share out loud? Okay, if not, we'll go on to the next slide. Oh, into exit. Okay, so now we'll just talk about mortality and morbidity rates. So as we discussed earlier in 2021, the United States maternal mortality rate reached a historical high of 32.9 deaths per 100,000 live births. And so this rate has fallen since then to 2022, but 80% of the pregnancy-related deaths in 2022 were preventable. And it also displays there's a disparity still remains within race in terms of mortality rate, and the U.S. has one of the highest maternal mortality rates across the world. And so just looking into Jacksonville specifically, Duval County in 2023 reported 47.4 maternal deaths per 100,000 live births, which is more than double the state average of 18.5 deaths per 100,000.
So these are some graphs I thought were pretty important to share. This was from the Jacksonville.gov website. I have three graphs that I think are pretty pertinent. So this first one is accessible care, the percentage of accessible care during the first trimester, and it's comparing Duval County versus Florida's percentage rate. So you can see that Florida stays above for pretty much, I mean, the entire time from 2014 to 2022, having more accessible care for women during their first trimester. You can't see the exact percentages, but that last percentage in 2022, Florida is at 71.6% and Duval's at 61.2%. And it's just a very large continuous gap, almost 10% throughout the years. So that's that one. And then the second one, which is on the next slide, is going to be the infant mortality rate, also comparing between Duval versus Florida. In this one, Duval stays above Florida this time from 2014 to 2022. And in 2022, it was reported that Florida is at 6.0 and Duval is at 7.22. And that is, once again, like 1% above the the other. So another big gap. And then for the last slide, for the last graph, it's going to be the maternal mortality rate comparing between Duval County and versus Florida as well again. From 2014 to 2022, there's more of a intersection where they kind of cross paths over the years in 2016 and in 2020. But then that last percentage, it's going to be Florida's going to sit at 15.2, and then Duval's going to sit just above it at 15.9. So a little bit closer together, but still a gap. And I thought those were pretty interesting to look at and to analyze when it comes to this issue.
So now I'm just going to talk about another concept related to maternal health. And this research actually comes from our original speaker, Dr. Peoples. She wasn't able to be here with us tonight, but we'd still like to share her research because I think it's a really necessary gap that hasn't really been, it's been overlooked in the past, but I think it's really important to look at now. So maternal near misses are defined as when a person experiences life-threatening complications during pregnancy, childbirth, or within the first 6 weeks of the postpartum period, but that they survive. So, for every maternal death in the US, there are nearly 70 near miss events, which is about 50,000 each year. And within this, Black individuals are about 3 times more likely to experience a maternal near miss, and Indigenous people and other minority groups are also at a disproportionate risk for them. And these issues usually stem from complications related to embolisms, cardiac events, hemorrhage, sepsis, and hypertensive disorders like preeclampsia and eclampsia, which are once again related to some of the social terms of health that we talked about earlier. So, really addressing behavioral factors and environmental factors when talking about maternal health, it's very, very important so we don't miss things like this. Um, and it really highlights problems within our maternal healthcare system that we're missing this really, really important data. And it's related to things like delays in diagnosis, misinterpretation of symptoms, and inadequate responses from healthcare providers, which is another thing related to the status of maternal health today. One of the reasons that there are large disparities between women of color within maternal health is that there's a lot of bias within the system. And so addressing that when we're talking about solutions is very, very important.
Then I want to go ahead and touch on the mental health effects when it comes to maternal health. So maternal mental health is very essential to look at, but often is overlooked part of overall maternal care. About 1 in 8 people experience postpartum depression, yet many go undiagnosed or untreated. In fact, 1 in 5 individuals were never even asked about depression during a prenatal visit, and those who do experience postpartum depression, over 50% don't receive any treatment at all for their disease. So there are many causes of mental health challenges during and after pregnancy. This can include hormonal changes after birth. It can include emotional and physical stressors related to pregnancy, the demands and exhaustion of caring for a newborn, and the pre-existing mental health conditions like anxiety or depression that may intensify postpartum. When left unaddressed, symptoms of poor mental health can significantly affect both the parent and child. These symptoms can include trouble focusing or making decisions, or intrusive or unwanted thoughts and feelings of irritability or anger, sometimes with no clear reason. Addressing maternal mental health must be part of comprehensive care, not just during birth, but well before and well after. So we have another audience question. What are some current solutions you can identify that are addressing maternal health disparities? So go ahead and scan that QR code and we'll give you a couple seconds and then we'll show on the screen some answers.
While we are waiting for people to respond, I do think that it's very important that mental health is included in that. Because like you said, it really does impact the mother as well. I learned last semester from Dr. Franklos over at FAMU that it also impacts the child and their life over time. So one of the things was that there was a correlation found between depressive and anxiety symptoms during pregnancy to behavioral and emotional issues to 5-year-olds. So like that around that time, right when they're getting into school. Not only that, mental health also would impact how they treat themselves during pregnancy. I actually have a cousin who's pregnant at this time. And so like being mindful of like even on your own, if you're going through something mentally, your eating habits or your appetite may pick up or it may decrease. But during pregnancy, you kind of need to be consistent in providing nutrients because it's not just you, you're developing someone. And so you can have gaps that would definitely be impactful. So knowing when, like, say for instance, having a mental health issue and not eating or not doing the right things by your body as a mom during your first trimester would be something very different than doing it during your third trimester, as even well postpartum as well, because all of those different phases mean different things, not only for the development of the child but also for the mom.
100%. And I think mental health, like you said, like it's just important to look at, especially during pregnancy, whether it's before you get pregnant, whether it's during while you're pregnant, or whether after you have the baby. Like pregnancy is a big decision and a big action. It's 9 months of a lot of changes to your body. So it's important to check up on the mother and especially the child if there is if the mother is suffering from poor mental health. So yeah, 100%.
Yeah, and I agree too. I think, especially during postpartum care, I think that's definitely an area that's always really missed, not even just in terms of actual medical care, but also mental health care. It's because postpartum depression is such like a predominant issue, especially among mothers of color. So I think it's definitely a great area to address. But here's some of our responses. I'll just read them out loud. So some current solutions that we can identify addressing maternal health disparities are moving resources into underserved communities, better access to mental health support, social support programs addressing policy downfalls and addressing socioeconomic inequality, and accessible virtual care options for expecting and new mothers. Those are really great responses. So speaking of current solutions, we're going to talk now about some proposals that have come into the policy arena recently. One of the ones that I really looked into was Black Maternal Health Momnibus Act. So this act is not, or this proposal isn't actually enacted yet. It was first introduced in 2021. It kind of fell through, but then it was reintroduced in 2023 with a lot of reforms. And so some of the initiatives included in this act have to do with the workforce. So like I said earlier, diversifying the maternal health workforce is very, very important for representation within hospitals. Establishing various grants related to maternal health research and care overall. Testing alternative payment models for perinatal care. So it's really to do with healthcare access. It's really targeting Medicaid, but just using healthcare as an avenue for improving maternal health care. Extended postpartum and breastfeeding eligibility. Once again, postpartum care is very, very important for addressing maternal health care, and it's often overlooked. And I think this can be a great step forward. And finally, increased research and data collection on maternal health indicators. This just really helps you realize where the gaps still need to be met and where we need to improve. And so while this act is very monumental, there's still room for additional adjustments, especially related to reforming healthcare and addressing the eligibility gaps and just healthcare gaps overall that allow a lot of women to kind of fall through the cracks.
Right, I wanted to go ahead and talk about some Florida-based solutions, some current Florida-based solutions. So there are several programs currently in place working to improve maternal and child health outcomes, both at the federal and state levels. The first one I want to talk about is the Maternal and Child Health Block Grant, also known as the Title V MCH program. According to the 2022 annual report, this program directs funding and resources across Florida to support mothers and children through essential healthcare services, education, and outreach. At the local level, the University of South Florida's Mother Focused Care Initiative is another example of a targeted, community-based action that has prioritized care models that address the specific needs of pregnant and postpartum individuals, especially those in underserved communities. In this program or initiative, beginning in January 2023, the Centers for Medicare and Medicaid Services, or CMS, introduced new requirements for hospitals. These include mandatory screening for social determinants of health, like we were talking about before, which increased the percentage of hospitals doing this from before from 8% to 65%. So this included things like looking at things like housing or food security and access to transportation. And this helped deliver a more respectful and patient-centered level of care. These are steps in the right direction, but now we'll look at how we can build on them through proposed solutions. So this is a success story I want to talk about from the Title V Block Grant Program. So in the aftermath of Hurricane Ian, a devastating Category 4 storm that struck Florida in September 2022, the Florida Department of Health, supported in part by the Title V MCH Block Grant, mobilized teams to provide critical maternal and child health care services. Teams from the maternal and child health section, including nurses and data analysts, were deployed to special needs centers in Lee and Sarasota counties. These professionals assisted with mobility, medical oversight, and shelter safety, and the transport of clients during the transition back to schools. Additionally, the point I really want to center on is the department coordinated donations and relief supplies for mothers and families, distributing essentials like diapers, formula, and baby food in hard-hit counties in Florida. This recognizes the importance of showing breastfeeding support for mothers who are in need of assistance, especially during that time, during the natural disaster. They sent 100 rechargeable breast pumps, 50 manual pumps, and 100 portable chargers, and much more to help those mothers who need it the most. These are just like some examples of protecting maternal health, not only during routine care, but also in emergency disaster response, ensuring that mothers are not forgotten during crisis relief efforts or in everyday life. Now, these are some more graphs I wanted to touch on. The one on the left is the maternal mortality rate by race and Hispanic origin in the United States for comparing both 2022 and 2023. And we see that number again, 49.5 in 2022, where non-Hispanic Black women are the highest rate out of the other races. And in 2023, it looks like that rate increased by about 0.8%, sitting at 50.3. On the right, we have the maternal mortality rate by age in the United States, comparing 2022 and 2023. And for women ages 40 and older, it looks like in 2022 it was 87.1, and in 2023 it was 59.8, being the highest among the three groups. What does safe maternal care look like? So this is very general, but I think that it's pretty important to touch on. So I think that addressing every issue that we stated before, safe maternal care looks like accessible prenatal visits. It's every pregnant person being able to schedule and attend regular prenatal checkups without barriers, without having to worry about things like cost or transportation or taking time off work or getting a babysitter, things like that. It also looks like having doulas covered by their insurance, by Medicaid. States that include doulas in Medicaid coverage have shown improved birth outcomes, especially in Black mothers. Respectful, bias-free care, that's what it looks like. Safe care means being treated with dignity regardless of race, class, or income or language without partaking in implicit bias. Integrated mental health screenings, looking at social determinants of health as well. Routine mental health check-ins should be a part of standard maternal care, both during and after pregnancy, to make sure that the mother is in the best mental health state as possible to take care of her child and for the child's mental health as well. And then finally, support during the postpartum year, new parents having continued access to medical care, lactation support, childcare resources, and mental health services for at least the first year of birth to make sure that they're adjusting to new parent life safely.
So now just to talk about what the safe maternal care looks like in terms of policy solutions. This is some research that I found that looks at how maternal care can be improved through things that we can integrate into healthcare settings and then also into hospital settings. So first thing I'd like to talk about is Georgia Medicaid doula pilot findings. So in Georgia, a nonprofit partnered with 2 Medicaid managed plans to provide birth doulas to several pregnant recipients. And through this research, they found that birth complications were decreased by 50%. And many of the clients involved in this partnership reported feelings of increased competency from hospital providers and also feeling more protected by their care providers, which really highlights the importance of doulas in advocating for the safety of mothers. It's also related to just a more holistic model of care where people are being advocated for within the maternal care settings. This is related to patient-centered medical home model, which just a comprehensive healthcare model that centers the patient and ensures that there's a relationship that's full of trust between the provider and the patient, where their needs are really being met. And this includes community workers and culturally competent providers like doulas. So integrating this into a healthcare plan that is more comprehensive, it can really do wonders at addressing maternal health disparities. And then in terms of hospital settings, I believe bias trainings talked about a lot, but also maternal mental health trainings could also be a great solution. It provides training, it provides providers with really great information about what mental health care can look like for a new mother. And it also increases feelings of trust between the patient and provider and informs better decision making within that process. And then finally, a quality measure index is just related to data management. So collecting data on biased behavior, monitoring like what's happening in the hospitals, and then also unnecessary cesarean sections, because those are a major determinant of maternal health risk, and using these to assess the success of provider trainings.
And then these are just some more proposed solutions on what we can do at a local level or on a county level. The first one is developing local policy solutions, advocating for city and county level maternal health initiatives, increasing insurance coverage, to expand equity and insurance for women and groups with higher rates of maternal morbidity and mortality. We can also invest in community-based programs supporting organizations that provide doulas, midwives, and peer support, and also by partnering with trusted community leaders and advocates to reach vulnerable groups or positions. And then finally, improving research and funding to institutions tackling the maternal health issues. And do this by increasing federal and state grants for maternal health studies and or funding research on racial disparities, implicit bias, and community-centered models.
So this is our last question for the audience. What is something new that you learned tonight about maternal care? How can you take what you've learned tonight and apply it to future solutions? While we wait for some responses, I'll just say, when I was doing the research for this, I learned about maternal neuromisses from Dr. Peoples when we were talking about having her as a speaker. And it was something I obviously knew about, but I didn't really take it into account as it's another factor affecting maternal health and how it's really overlooked in research and overlooked when we're capturing the full extent of the maternal health crisis. So something I learned new within this week. In terms of applying it to future solutions, I think that's part of also capturing the full amount of data related to maternal health care, and then mortality and morbidity. I think we usually capture the mortality part, but not really the morbidity part, and that can be a really big determinant in someone's survival.
I also, well, I didn't know. I learned about the weathering effect. Like, of course, that's a recognized phenomenon, but to know that there is now a title and that there is research back behind it and that there's evidence to prove that, like, this is something that is really occurring over time and that this is really what is contributing to poor health outcomes, not just for Black moms, but for Black people across the board, because these excessive amount of stressors from economics, from housing, from policy standpoint, from just every different standpoint, it's all of these complex issues that builds up over time and then it takes control.
One thing I have learned over the last year really is that the state has invested in maternal healthcare studies, one in Orlando and one here in Jacksonville. And we've learned a lot from those. In addition to that, the city of Jacksonville has launched a Care Connect initiatives. And one of the things that they've done is their, I guess the mayor's transition health committee made that a priority to focus on maternal health. And the Florida Department of Health, what we used to call the Public Health Department, the Florida Department of Health, Duval County, operates programs like Healthy Start and Maternal Child Health Equity Collaborative to offer maternal screenings, education, and referrals. So I think there is an uptick in focus and awareness. And actually, the Mayo Clinic has provided the Urban League with a small fund to help with an initiative in a public awareness program that we'll be conducting over the next year. So those are some of the things I've learned about, and I really appreciate the work of our interns in presenting tonight and providing information on this, and I look forward to hearing more from them and from the other questions and responses we may have this evening.
All right, looks like we have 2 responses so far. One of them is access alone isn't enough. We need culturally competent care and trust building with underserved communities. And then the next one is the role of everyday stressors in maternal health was new to me. It was very interesting to learn. It made me realize how deeply social factors affect health outcomes. 100%. I think it's something that a lot of people don't really consider, don't really have the time to think about. But once you sit back and think about it, there's a lot of factors that really contribute to poor maternal health. And I see somebody dropped in the chat as well that someone learned about the Florida Block Grant and the USF program for maternal health. Yes, definitely. That I was honestly surprised to hear that, to see that in such a local level, to see that there's stuff being done on a local level, especially because of the rates that we saw from 2022 and 23. So definitely pleasantly surprised to hear that that there's something being done about it. And then I see a question. Should I address that now or should we wait till the end to do questions? Do you think?
Up to you.
I think we can implement it now. We can just kind of do closing statements afterwards.
Okay, gotcha. All right, I see the question that says, do we have any idea about how the One Big Beautiful Bill will affect the block grant? I don't know. I do know that when it comes to the Big Beautiful Bill, there's a lot of funding being cut, so I can see it being impacted. Um, isn't it cutting Medicaid as well?
Yeah.
Well, I'm very concerned that it's not only cutting Medicaid for some individuals, but also they're putting barriers. This is one thing that people don't realize, and there may be some pushback once it starts to happen. Apparently, the Senate is doing that right now with it on some issues, but they're creating these barriers. For instance, you have to renew every year. You know, anybody that has health care through their job or even through Obamacare, generally you don't have to, once you sign up, you stick with the same insurance company unless the insurance company wants to change or raises your bill so high you want to move to somebody else. But with Medicaid, they're going to make people sign up every year and prove that they're working. I mean, it's predicted to have a significant impact on access to Medicaid.
Yeah, I was gonna say I don't know how to affect the grant, but I definitely know that any progress made towards fixing those eligibility gaps and then expanding the care that's related to Medicaid and Medicare will be lost with the one big beautiful bill. So, like, if the option to add like doulas and other holistic providers to the list of providers that are options for Medicaid recipients, it's definitely gonna be a big barrier.
A good point.
Do we have any other questions or thoughts or anything that anybody wants to share? No, that's okay. Well, I just want to thank you all for coming and listening, participating in our discussion. Victoria and I, this is a really interesting topic to us, and so we're really glad that we got to speak on it today and share some of the research that we found. I think it's an area that I think it's talked about a lot, but we don't have enough discussions about it, especially like within like where the future of what this will look like in policy spaces and medical spaces, data management, all of that. So having these discussions more within our group and then with policy leaders, other people who are in power right now is really, really important. So thank you guys for coming today and listening to us speak.
And I wanted to thank you for your presentation. I learned a lot, and there'll be a lot of people watching this on YouTube who will learn a lot as well. So thank you very much. Thank you to all of our interns and to Sadia Barge, who has been coordinating our interns. And we've had a very busy summer. We have another town hall tomorrow night, which is going to focus on immigration and its impact on our community, the immigration changes. So we look forward to that, and we invite all of you to join us. And on behalf of the Urban League, I wish all of you a great evening and look forward to seeing you at other town halls, whether it's tomorrow or others in the future. Sadia, we have a couple more next week, don't we?
Yes, we do. So we have a DEI town hall on Monday, as well as I want to say housing discrimination on Tuesday. But if you signed up, I will make sure that for all of our registrants that it is going out to you all, as well as be sure to follow us on not Facebook, Instagram, as well as our LinkedIn, and then feel free to check out our webpage as well. Those things are being updated thanks to the amazing work of our interns.
Thank you.
All right. Good night, everyone.
Thank you. Good night.